Hi, everybody. This is Dr. Sridhar, Vennamaneni at Prathama Hospital, Kukatpally. Today is World Hypertension Day. So I'm just going to give you a brief update on hypertension. Just want to educate you on what to look for, what are the common causes, what are the complications, what is the treatment guidelines. So just a simple thing for all of you. So when we say hypertension, what it basically means is it's the pressure that your heart is putting on your blood vessels, and when the heart is squeezing blood, that pressure is reflected on your blood pressure. Two different measurements. The top number is called the systolic blood pressure, and the bottom number is the diastolic. So when we check your blood pressure, we want both the numbers to be perfect. Normal blood pressure is less than 120/80. And if it's running high, above 120/80, there are a number of causes. We want to keep measuring these numbers, periodically to see if the first number was it high because of anxiety or stress, or was it a real true number. So we always want to keep track of a patient with high blood pressure. So blood pressure, most common causes are usually lack of exercise, eating salty foods, smoking, alcohol. These are very common. And then you have other causes, secondary causes. There are patients with thyroid problems, patients who are obese, or patients who have a condition called sleep apnea, patients with kidney problems, where they have a kidney disease, or if they have blockages in the kidney arteries, and a bunch of other adrenal, hormonal issues. Basically, the number of causes, the common causes are still, some of it is genetics. If you have a family history of high blood pressure, you're more prone to have high blood pressure. But also, number 1, 2, and 3 is diet, lack of activity, sedentary life, smoking, stress, alcohol. These are very, very common. So I don't want to dwell into the secondary causes. The primary causes, the primary hypertension is much more common, and those are things that we can easily change. Now, most patients with blood pressure are asymptomatic. Most people have blood pressure running, like I said before, normal blood pressure is less than 120/80. Now, you could have a blood pressure of 150/90 or 150/100 and may not have any symptoms. And also, most patients, in fact, about close to 50% of patients don't have any symptoms. So you normally start having symptoms like dizziness or headache or off balance or chest pain or difficulty breathing. All these will happen only when the blood pressure is significantly high, like 180 above, top number above 180, bottom number above 100, 110, 120, the diastolic above 100. That's when you start having symptoms. The other reason to have symptoms is if your blood pressure has been running high for a long period of time, then you have slowly changes in your heart. Your heart muscle gets thickened. We call it left ventricular hypertrophy. You'll have changes in your kidneys. The kidneys function may start going down. Then you might have some kind of symptom. You might have difficulty breathing, you might have palpitations, you might have severe weakness, cramping. So those are symptoms that might develop gradually if your blood pressure is running high and you've never had it checked, or if you've ignored it. Then these changes in your heart or your brain or in your kidneys, all these can lead to symptoms gradually. Now, what are the complications of untreated high blood pressure? Now, we aim to keep the blood pressure ideally less than 120/80. Now, we say blood pressure is high when it's above 130, the top number systolic above 130, and the bottom number above 80. The reason why we give that 10-point leeway is because studies show that every 10 points above normal, your risk of heart attack and stroke doubles. So we want to keep it low as much as possible. Now, when the blood pressure is above 120/80 up to 130, we say it's high. And if it's running above 130 persistently, that's when we say you have hypertension and it's time to act. What happens when you don't treat blood pressure? Like I said before, the complications, the most common complication of untreated high blood pressure is heart attack. Long term, the blood vessels start getting thicker inside, the blood flow starts getting reduced. And typically, patients with high blood pressure also can have high cholesterol, they're more prone to have diabetes. So all these are other risk factors that will increase your risk of heart attack and stroke. So the number one complication of high blood pressure that's untreated is heart disease. Also heart failure, congestive heart failure, where the heart muscle gets so thickened that there's no space for the blood to come and fill. So what happens, the blood, instead of moving forward into the arteries, is backing into your lungs. So you develop shortness of breath, you start having swelling in your legs, you start having palpitations, you have minimal, walking a few steps, you're huffing and puffing, you don't have much appetite. So all these are symptoms of congestive heart failure. And the most common cause of congestive heart failure is high blood pressure. Now, the other things that we see with the high blood pressure, like I said, is slowly the kidney function starts deteriorating and you develop what's called chronic kidney disease. And if you don't go to the physician and have a routine checkup for your kidney function and do a 2D echo or ECG, all these are things that can go undiagnosed. And kidney disease, once it gets to a stage 4, it's irreversible. Up to stage 3, we can try to minimize the further damage by keeping your blood pressure under control. So the other things that can happen if you have untreated high blood pressure is risk of strokes. The blood vessels to your brain, they can get clogged with blood clots, and that can lead to strokes. Or if your blood pressure is very high persistently, then you can have a rupture of blood vessels and you can have severe bleeding inside the brain, which can lead to death. So blood pressure is easily treatable, and the only way to diagnose that is, first you have to see your physician once a year, have a thorough checkup, and typically if it's running high, you need to buy a blood pressure machine, keep track of it, and your goal should be to keep it mostly less than 120/80. Up to 130, between 120 to 130, that's when we say it's borderline, and above 130 in systolic above 130, diastolic above 80, that's when we say it's high. Now, what can you do in terms of prevention? If you have a strong family history of high blood pressure, or if you're a smoker, or if you're an alcoholic, all these are things that will increase your risk. The first thing, most important thing, is diet. There are numerous studies that show that if you exercise, if you diet, if you watch your salt intake, you can easily bring your blood pressure down 10 to 12 points down without any medication. So I would strongly suggest reducing your first salt intake. So especially in India, we use a lot of pickles, a lot of salt in pickles, and if you're eating ready-made snacks like chips and fries, or anything that's packed that you can eat after a month, anything that's on a shelf that's lying there, imagine kurkure, all kinds of anything that's packed like kurkure or chips has salt in it, because salt is a preservative. So I would strongly suggest you stay away from those, because they're also loaded with a lot of fat. They're fried in oil, and salt on top of it is asking for trouble. So salt is number one. So typically we recommend a salt intake of less than 1500 milligrams. So that comes to about 1 teaspoon of salt. If your blood pressure is high, you just need to limit to 1 teaspoon. If you're somebody exercising a lot, if you're somebody who is working outside, sweating a lot, then you can increase your salt intake to close to 2 teaspoons. But otherwise, 1500 milligrams is a cutoff. Now, the second thing, the most important thing, is diet. There's a big study done many years ago where they looked at people who were eating more vegetables, some fruits, some nuts, staying away from too much fried food, going with more plant-based protein, lentils, beans, that kind of food, and reducing the meat intake. They found that these patients' blood pressure dropped significantly compared to somebody who was eating a westernized diet, eating more burgers, pizzas, fried food, fried snacks, stuff like that. I would strongly avoid. So the recommendations are, try to eat more vegetables. The emphasis is reduce your meats, increase your vegetables, fill that plate with a lot of vegetables, small amount of rice or roti, one or two small rotis, multigrain. Meat consumption should be really small. It should be like maximum is a quarter plate, like in a plate, really small portion. After diet comes exercise. Exercise is very, very important, and typically the American Heart Association recommends exercise at least 30 to 45 minutes, 5 days a week. So the word is moderate exercise. If you're doing brisk walking, slow jogging, some dancing, Zumba, all these count, biking, doing it, and then add some strength training to it. So if you're doing 3 days of cardio, and you can add 2 days of strength training to that, or you can mix both every day. So by the end of the day, 5 days at least 30 to 45 minutes, that's recommended. Now, the other thing other than exercise that are common factors associated with blood pressure is smoking. So smoking, once you start smoking, your blood vessels start getting tighter. So a tight blood vessel means pressure is high inside. So in addition, smoking increases your risk of heart disease, strokes, cancer, all kinds of cancers, memory loss called dementia, poor circulation in your legs, you develop aneurysm. So a lot of complications from smoking. So strongly suggest quit smoking. The other thing that I would strongly suggest is reducing your alcohol or quitting alcohol. Alcohol typically raises your blood pressure, but also causes, if you're drinking more than 2 drinks, especially men, 1 drink will be 1 beer, a small beer, 30 ml of either scotch or whiskey or rum, that's 1 drink. So not more than 2 drinks. If you were to do more than 2, again, your blood pressure can start going up. If there'll be changes in your heart, can lead to heart failure. You could have changes in your brain, which can lead to dementia. And a bunch of other side effects, liver side effects, and side effects on your bone. So the current recommendations are, if you really want to enjoy your drink, have not more than 2 drinks for men and 1 drink for women. So that's the cutoff. Now, in addition to these, if your blood pressure is running high, most patients with high blood pressure need 2 to 3 medications. So please don't assume that if you're on 2 medicines that this is too much and that you need to be cutting down. Typically, we do cut down on medicines. If your blood pressure starts going down, we cut down the medicine. So there's no hard and fast rule that once you're on medicine, you'll be on medicine forever. The medicines will be reduced, but it depends on how often you're monitoring your blood pressure, how is your blood pressure. If the numbers start dropping, your medicines will go down. For patients who have constantly high blood pressure running above 140, 90 in spite of being on medicines, 2 or 3 medicines, then we need to do further investigations. We need to look at your thyroid, we need to look at your adrenal glands, we need to see if there's any blockage in your kidneys. And then we need to check and see if you have a condition called sleep apnea. We have to check and look at your medicines, because sometimes chronic pain medicines like your Combiflam or aceclofenac, all these can raise your blood pressure also. So it's very imperative that if your blood pressure is high, please don't ignore it, because it's a silent killer. It's called the number 1 silent killer for that reason, because most patients with high blood pressure will not have any symptoms, and most patients with high blood pressure typically also have high cholesterol and diabetes. So for that reason, please get tested and work on yourself, work on prevention, because the number 1 cause of death in India and all over the world is still heart disease, and blood pressure is one of the biggest risk factors. So I want to finally emphasize the importance of keeping your blood pressure less than 130/80. So less than 120/80 is perfect, but up to 130/80 is the maximum that it can be high when you're on medicines. So just keep track of your blood pressure and have regular blood work and regular checkups. Thank you.